Hello, this is Dr. Lowe with the third segment recording for the second food to fuel case. This covers only a couple of entities and should be quite brief. First is a brief review of GI effects of cystic fibrosis. You've already discussed cystic fibrosis in the vital fluids and gases block, but there are some GI effects. In the newborn, the increased viscosity of the meconium due to the transport defect and failure to hydrate the intestinal contents normally can result in meconium ileus with intestinal obstruction in the newborn period. Once the child is past that, there is a gradual risk of development of pancreatic insufficiency. Again, the viscous pancreatic secretions lead to stasis, release of pancreatic enzymes into the pancreas, and eventual autodigestion and destruction of pancreatic tissue with pancreatic acinar insufficiency. The treatment for this in the patients is oral pancreatic enzyme supplements. These enzyme supplements actually will digest the patient's food, and if you put them on the food, the stuff becomes rather disgusting in short order, but that's what the kids will have to tolerate. The other topic here is mechanical intestinal obstruction. There are two major forms that we're going to talk about. I'm not going to talk about hernias or adhesions, but two of these are intussusception and volvulus. With an intussusception, a portion of the intestines telescopes into the distal bowel. It can be due to dysregulated peristalsis, a mass in the bowel wall that gets pushed along by the intestinal contents. As you'll see in the next cartoon, this can result in obstruction, and because of the increased pressure, there may be ischemic damage to the bowel. Volvulus consists of a segment of the intestine that twists on its mesenteric pedicle. This compresses the vascular supply and may cause ischemia in addition to bowel obstruction. Here you can see these two cartooned. The intussusception is on the right. The more proximal portion is at the top, and the flow is towards the bottom. You can see here that there's actually two additional layers of bowel wall in the intussuscepted segment. And you can understand how that would result in both compression and some obstruction. Volvulus is essentially almost a slip knot of the bowel here, and again, because the venous and lymphatic supply becomes interrupted, there will be, or compressed, there is edema, and this can result in ischemia in the bowel wall. That's all for this segment. Thank you.